everybody. So we are going to do a quick video on the renal system. We don't have a ton of structures on the list, so this should go pretty quick. But we already have our kidneys and ureters and bladder added on Mr. Skeleton here. So let's get started. First thing you might notice is the left kidney is a little bit higher. And let's just go through our list here. So the first thing on our list of structures on anponline.com are the superior and inferior poles of the kidney. So we need to hide this adrenal gland. And we can see it doesn't look like they actually label it, so we'll just draw it in. So just the top pole would be the superior pole, and the bottommost point is the inferior pole. Why are those clinically relevant? Well, if you ever do visceral palpation, organ palpation, you can actually palpate the inferior pole of the kidney and just see if that's painful for your patient or if there's any obvious swelling. So you actually can palpate that inferior pole. So superior and inferior pole. Borders, lateral and medial, pretty straightforward. So, lateral border, medial border. Okay, just based on direction. So far, so good, pretty simple. Now we're going to get into some of the structures, some of these internal structures here. So I've already removed the anterior half of this left kidney. So we can kind of see in here. And our first structure is the renal pelvis. The renal pelvis, it's just sort of this funnel leading up to the ureter, taking urine from the kidney to the bladder. So it's a collection of the structures we're going to name here in a second of these major calyces come together to form the renal pelvis, which turns into the ureter. Actually, though, our next structure is the cortex and medulla of the kidney. Cortex and medulla are terms used all the time. They're used in your hair has a cortex and a medulla. The adrenal gland that I just removed has a cortex and a medulla. A cortex just refers to the outer layer of something. So this outer layer of the kidney here is called the cortex. And I think they even have it highlighted if I click, yeah, renal cortex, there it is. The medulla is all of this stuff within the cortex. And we kind of lose track of it there. There we go. Excluding these calyces. Okay, so that is the renal medulla, and then the renal cortex is on the outside. Okay, so within that medulla, we have some structures here. So we call these the renal pyramids. Within the medulla is where all the actual functional tissue of the kidney is, all the nephrons and glomeruli and all those structures. That we're not going into that detail, it's just gross anatomy, but it's all within the medulla, particularly within these pyramids. In between the pyramids, we have what are called the renal columns. Both of these structures are a part of the medulla. And then we have the calyces. So the calyces are these little collecting ducts. So the first set of calyces coming right off of the pyramids are called the minor calyces. As the minor calyces come together and merge and form bigger structures, we call them major calyces. And then those calyces join to form the renal pelvis, which we already mentioned, which becomes the ureter. So you have your left and right ureter. Those drain urine into your urinary bladder where urine is stored. And that's actually really it for the renal system. I do just want to mention the renal artery and renal vein. It's going to get a little messy here. I apologize because there are a ton of arteries and veins. On the quiz, it'll be real easy for our class because if you see an artery tagged delivering blood to the kidney, well, that's going to be the renal artery. So this will be the right renal artery, and then this will be the left over here. So we have the left renal artery and the right. And then we have the renal veins, the right renal vein and the left renal vein. And that, my friends, is it. That might be our shortest lab video ever. Let me know on Canvas if you have any questions. I'm going to post this right now and you guys will have a practice test up soon. Thanks.